Hello, today we'll know about what is brain hemorrhage. It's a very important topic. I'm Dr. Atma Ranjan Das. I'm a senior consultant neurosurgeon in Care Hospital, Bhubaneswar. So we'll understand what is a hemorrhage. Hemorrhage means bleeding. And when it happens inside your skull, inside your brain, this is known as brain hemorrhage. So there are two divisions of brain hemorrhage. One is traumatic accident related brain hemorrhage because of head trauma, and second thing is brain stroke, hemorrhagic brain stroke. So there are two types of brain hemorrhage. One is hemorrhage because of head trauma or traumatic brain injury, and second kind of hemorrhage is hemorrhagic brain stroke. So we'll understand what is this, how to identify a brain hemorrhage, and how to treat a brain hemorrhage and a hemorrhagic stroke. First, the first sign is, because we know our skull is all around covered by the cavity which is known as calvarial cavity. This is skull. This is a bone, strong bone, which protects a very soft neurological structure which is there, which is called as the brain. We call, some people call it's very the neural structures are very soft. So that's why God has given us this bone to cover it, to protect it. But sometimes, unfortunately, we sometimes met up with an accident. We have a head banging on the road, and somebody, while driving, you are not wearing a helmet, and you met with an accident and end up with a traumatic brain injury. In those cases, there are three kinds of brain hemorrhage which happens because of this trauma. So one is an extradural hemorrhage, which happens just below the skull bone, which is known as extradural. There are other varieties of brain hemorrhages also, which is trauma related, accident related. So you have to understand there is a golden period in brain hemorrhage. If you are having an accident, we have lost many young boys because of this traumatic brain injury. So time is the most important thing. If somebody had an accident or is having a traumatic brain injury, the timing is very important. So once, if you find somebody lying unconscious on the road just after an accident, he is probably, or she is probably having a large brain hemorrhage. That's why he is unconscious, he is not responding to commands. So your job is to immediately bring the patient to the hospital for evaluation, because the timing of the treatment for the brain hemorrhage is very crucial, which is known as a golden period. Like we know, when you have an heart attack, you have to go to the hospital immediately and stay within this golden period. So there is a proper timing when you should start the treatment to save the life of the patient. So you have a head trauma, you land up with a large bleed inside the skull, come to the hospital immediately, because if you get your treatment in time, there is a high probability you are going to get saved. So time is important. The second kind of trauma is hemorrhagic stroke. So stroke are two types. One is a ischemic stroke, another one is a hemorrhagic stroke. So what happens, there is a hemorrhage which happens inside the brain because of a rupture of a vein or artery, which is known as brain hemorrhage or hemorrhagic brain stroke. So that is also very crucial. If somebody is sitting talking and suddenly he become unconscious and starts not responding to commands, then there is a probability he may be having a stroke, which may be a hemorrhagic stroke. So in those conditions, again the timing is very important. You should reach the hospital in time and take out this bleeding which is there inside the skull. So most of the cases, if the bleeding is small, there is no need of surgery. If the bleeding is large, sometimes we have to intervene and take out this bleed. So once you reach the hospital, we immediately do a CT scan, which will show you whether you are having a brain hemorrhage or not. So the CT scan is done immediately, and sometimes we have to ensure the fluid and hydrate the patient and start the treatment. So in some cases where the bleed is large, or which is known as midline shift, if the blood is compressing your soft brain, then we have to take out the bleed in those conditions, and has to be done immediately if it is needed. And in hemorrhagic stroke, you have to evacuate the bleed. If it is a small bleed, we can manage it conservatively. If it is a large bleed, we have to take this bleed out. So CT scan will give us a point whether how big is the bleed, is it big, is it small, that is decided on the basis of that on the CT scan. Then we proceed. If it is needed, we do 24/7 neuro emergencies, brain emergencies, where we will take the patient and evacuate this bleed immediately without any delay and save the life of the patient. So the bleed evacuation can be done because we know all around there is a skull. So most cases when there is a bleed inside this small brain, so the brain starts to expand. In those conditions, we sometimes have to take out this bone and keep it in the abdomen and release the pressure which is produced inside the brain. So that is the concept, that is the surgery we do, and if it is done immediately, we can save many lives. So it is an awareness and the time to act. When you see somebody just suddenly talking and falling down, having a paralysis immediately after the after some discussion or talk, or the patient is having severe headache. Sometimes hemorrhagic stroke can mimic as a severe headache. The patient will say, I'm having very strong, very severe headache. I've never experienced this kind of headache in whole of my life. So in that condition, and it has to be sudden. In those conditions, there may be a possibility of having a brain hemorrhage. So in those conditions, you need treatment urgently. You should visit the clinician or neurosurgeon to get yourself evaluated and get yourself treated. Now there are recent treatments in KR Hospital of Bhubaneswar. We have navigation guided and endoscopy guided hematoma evacuation, where you can operate the patient with a very small incision, with proper help of artificial intelligence, that is known as navigation system. With an endoscope, you can remove the hematoma and save the life of the patient. Thank you so much. Be aware about the brain hemorrhage. If you have a sudden severe headache, please contact your doctor immediately. Thank you.